My name is Mr Jyoti Basu, commonly called Jyoti Basu to my colleagues, and I'm a consultant urologist working for Bradford Teaching Hospitals NHS Trust, and I work in Bradford Royal Infirmary as a part of the Trust's main center. I am a urologist, and I have a special interest in stone disease, BPH management, prostate management, benign prostatic hypertrophy management, and kidney cancers. That's my area of subspecialization and interest. Well, that's a different question to answer because right from a very young age, I lived with my extended family, and my grandma used to be very close to me, and she had heart disease, and she used to get very ill, particularly during the monsoon months, when the rainy season, because of her mitral valve disease, which later I realized. And the doctor used to come out, make her better, go away, and then she would be fine better. And that sort of instilled a spirit in me to pursue this branch later on in my life. So as I progressed to my high school and my college, medicine appealed to me, making people better, talking to people, that really appealed to me. And that's what primarily made me choose doing medicine, and particularly a branch of clinical medicine where I have contact with patients and I can talk to patients, I can understand their problems. So that's what my driving force has always been. I did not choose my path to be a urologist at the very beginning, because in India I had done general surgery, I'd done plastic surgery, and when I came to UK, I came with the idea of doing something in plastic surgery to get my higher surgical training. But at that time, I think plastic surgery was very, very competitive, and it was very difficult. But then I got exposed to urology, and one of my consultant mentors, he sort of took me under his wings, and he exposed me to endourology, and I was really interested with the lasers and ureteroscopes and minimally invasive surgery. That really appealed to me. And ever since then, I have never looked away. I've always been interested in endourologists, and that's what I am at the moment. I'm an endourologist, so I do a lot of stone work, and that spirit has been with me ever since. Uh, the most rewarding thing is to make patients believe that they have improved, and to be honest with the patient, that we can't cure everything. We can probably make a bit of difference in their life, make them better. And in some cases, we do cure, particularly with stone disease. They are suffering in agony, and that really helps them to sort of get better when the stones are gone, and they feel much, much better. And also, particularly much more rewarding is in patients of cancer, kidney cancer. When we remove the cancer, we treat them, they're relieved, and we can feel that they've crossed that hurdle, and they are into a new life. And particularly when we see this when young people who come up with kidney cancers and we do their surgery, at least that is a life-changing thing for them. And it really is uplifting for a surgeon or a medic to be a part of that process in their life. That's what drives me. That's what makes me happy. Well, I think what I've little feedback I've heard is honesty. Is the very fact that I lay out my principles right at the very beginning. I have more of a like an unwritten contract to say that I will be able to do this, I will be able to deliver this, I won't be able to deliver this. So that's what is very important to the patients, because you see, patients' profiles have changed nowadays because of social media and internet. They are aware of what else is available. So they are quite educated in what I would say educated. They know what is available, but they know what is right for them. So my job, I think, is to point out to the direction that this is the right thing for you, because I have the knowledge going through all the different modalities of treatment, their clinical condition, I can then match it to them and present it to them. And it's up to them to take it, understand it, and go with it. Because the marketplace is there and there's a huge choice in the marketplace. You can have this, you can have that. And the daily newspapers, they blurt out things. And when people come in and say, oh, I've got this in the newspaper, why can't you offer this? I said, well, I can offer this to you, but you are not the right patient for this. So that's what my strength is. And what do I like about my patients? Some patients are difficult. Of course, there will be difficult patients. And some patients are ever so grateful. So this is what really sort of lifts my heart up, is that when people come and say, thank you, there's nothing better than that. That whatever you've paid me, I think it is okay. But at the end of the day, when I drive back home, if I've seen 3 patients who have said that really you made a difference, and thank you very much for that, it really makes my day. One thing I always believe is that we should not do no harm. That's the first principle I believe in. What the patient has, I should not make him worse than this. Whatever it is, if I can't make it any better, then probably it's no point in offering him any surgical treatment, telling him that, look, I can't make this one any better. Or be realistic about the outcomes. Tell them that, look, I can try this, but according to the evidence there is in the literature, there is not much of hope in doing this, or you may not get any better. And it's up to them then to decide. So I've always worked on that principle that the patient should not come back and say, I was this and you made me this bad. So if I can avoid that, of course, I can't always avoid those situations. Complications will be there. If you're doing enough surgery, there will be complications. But at least if I can point out that there are possible loopholes in there and I cannot step on that. And that comes with experience. I think I've been doing this job long enough to actually see some experiences that I can see.